You are watching the Doctalk show.
Non-communicable diseases such as heart disease, high blood pressure, diabetes or cancers take an enormous toll on an individual. And not only an individual, it takes a toll on the community and the country. Before I went for the break, we were discussing the impact of NCDs on the country as a whole and what the government has done in fighting NCDs. We got to know there are very interesting policies that have come up to address these problems. For example, the alcohol bill, which aims to restrict the amount of alcohol someone drinks, and the tobacco smoking bill, which has banned some tobacco and smoking products. So I want to know, at a community level, what is being done to fight these NCDs? Are there support groups that help people with NCDs? Are there what is being done at a community level is what we want to understand. So directed to Dr. Tony, your experience with the Uganda Protestant Medical Bureau, you do a lot of work in fighting NCDs at a community level. So what has this bureau done, and what can people learn?
The government came up with a policy, which is the Public-Private Partnership for Health policy, that brings different players, and the Uganda Protestant Medical Bureau, or UPMB, is one such organization that comes into that space. So we work together with other bureaus, because there are also others. But through that space, UPMB coordinates 302 health facilities across Uganda, and these include hospitals, where Mengo Hospital is our largest hospital. It's here in Kampala. And the network goes on to include health training institutions, where we also have Mengo Hospital as one of the training area, and other training institutions. So through our network, which is scattered across the country, all districts virtually, we reach the communities that need these services. And we've seen a situation whereby over years, the health workers who are in these rural areas have kind of lost their touch with non-communicable disease knowledge.
Okay.
Mainly because over years, the view was mainly treating communicable diseases like HIV, TB, malaria. And so we've seen that the knowledge and skills towards responding to non-communicable disease has been a problem. So we felt that through the space that we have with the Ministry of Health, that we would build their capacity again, so that they are able to respond to the non-communicable disease component. But also remember, our facilities are not living on an island. They are part of the health system. So we have village health teams, or VHTs, that link the community with our facilities. And this is a critical mass that is important in terms of ensuring that the communities are living healthy lives. And these are people who live in the villages. They live amongst the community members, but they're able to go to the facility and get trained and skilled, so that they're able to visit the different villages and pass on the knowledge. So in this particular case, we are looking at non-communicable diseases. So the VHTs who are strengthened or equipped with skills and knowledge about non-communicable diseases, they're able to go to families and impact those families with the same knowledge, the same messages, the same skills.
Exactly.
So we are decentralizing non-communicable disease services to the village level, and I'm happy that our partners, UPMB, are helping us in that direction, so that screening and also giving information, learning about non-communicable diseases is at the community level.
Exactly.
Yeah.
One of the things that we've seen is that you'll find, say, Mengo Hospital, that is at a higher level, being congested because at the lower level facilities, they don't have the capacity and competence to handle these non-communicable diseases. So we're also trying to see how can we decentralize as much as possible the response non-communicable disease to the lowest level, so that we can try as much as possible to decongest the tertiary levels, especially for the patients that are not so sick and are able to just go and pick their pills. And here we've partnered with Novartis Access, which is giving us drugs And these drugs are being kept at joint medical stores that then sends the drugs to the lowest level possible. And say, for example, if Dr. Lumu has seen a patient in Mengo, and this patient is stable, then Dr. Lumu can refer this patient to the lowest level possible so that they can get their pills.
To the smallest health center in the village, and they'll still get their medicine. Will it be free of charge, this medicine?
No, it's not free of charge because at the moment, but at the same time, it is heavily subsidized. Novartis is giving us these pills at a flat rate of 3,800 shillings per monthly dose.
Okay, that's fairly
affordable. I don't want to talk in US dollars because we are in Uganda. Yes.
Okay.
Yeah, but to correct that, medicines are not free in UPMB facilities.
Exactly.
They are free in government facilities.
The government. But people always complain the government, drugs get finished. They don't find drugs there.
That may happen, but it is reducing.
Because
health facilities used fear to procure drugs because they had a fixed budget. So whenever they would ask NCD drugs, it would almost finish their budget. Now, we have organized a budget centrally that when health facilities ask for these drugs, it is not discounted on their budget.
Okay.
So they can now get NCD medicines from national medical stores without necessarily being charged on their drug budget. So the drugs are increasingly available. I'm not going to say that there will not be any stockouts because our resources are still limited.
But sometimes there's a vision at least.
Yeah, sometimes you will find the drugs not there, but that one is increasingly reducing because we are providing more drugs. And this Novartis Access Program is actually our initiative, Ministry of Health initiative, where we are partnering with the renowned pharmaceutical companies to give us drugs at a subsidized price. Government pays for government health facilities, then our partners get the same drugs at a subsidized price so that they reach the patient at a much, much lower price than the market price.
What should one do to manage the NCD if they have it, or if they don't have the NCD, to protect themselves from getting it?
So as an individual, you have to take the right decisions, and these decisions or should be guided by the information. That's why we are here, to give the information, the right information. How one should eat, how one should exercise, what you should avoid, what you should take in moderation. So the individual, you are very key at preventing non-communicable diseases. Two, as an individual, you decide whether to go to hospital or not, or whether to keep your appointments or not.
Okay.
Then when you get these diseases, because inevitably, much as you may do all those, you may get the illness. You get the illness.
Which is a sad bit. Some people, they don't have any risk factors. They don't smoke, they don't drink, they are very active, but they still get like a cancer. So what should they do?
Now what they should do, because they shouldn't lose hope, they shouldn't despair. These conditions can be controlled, and somebody has an improved quality of life. So what should one do when they get these illnesses? To come to the hospital so that your condition gets managed and controlled. Take your pills as prescribed. Keep your appointments and try as much as possible to use compounds or medicines that have been scientifically proven. If you have any question, please write your questions down so that before you go to see a doctor, you have all those questions written down, and you ask and you get answered, and using things that are not proven. So as I wind up, an individual, you are very key in all this. Yes, Dr. Mutunji and Dr. Tony may put whatever they are suggested to put, but if you as an individual, you decide to adhere to that, we shall not have a healthy country.
Okay, so more about NCDs coming shortly after the break. We are with a team of experts who are leading the fight against NCDs in Uganda. If you have any questions or comments regarding this discussion, send it on our social media platforms on Facebook, on Twitter. You can also log on and subscribe to our YouTube handle, The Doctalk Show. We'll see you shortly after the break.
You are watching The Doctalk Show.